So, Namaskar. I am Dr. Ravindra Kumar Jena, Professor and Bone Marrow Transplant Physician, Department of Clinical Hematology, Sri Ramchandra Bhanja Medical College, Cuttack, Odisha. Sickle cell disease, as you know, it's a global health problem, including India. It is not only very commonly seen in tribal population, nowadays because of the population migration and intercaste marriage also, this sickle cell disease is prevalent across the caste and across the places also. Unfortunately, it has a massive social stigma due to various reasons, and sickle cell community or patients, they don't come forward to avail the benefits which are available. They don't come forward to demand between the government what are the optimal or the best healthcare facilities to be available. That is why the sickle cell community across the country, including India, they feel that they are neglected, they are deprived from the mainstream of the education and development. Considering all these points, our Honorable Prime Minister of India, Mr. Modi, has declared a very over-ambitious National Sickle Cell Elimination Program in July 2023 with a primary objective of eliminating and controlling the sickle cell disease in the entire country by 2047. It provides a very over-ambitious objectives, the probably first of its kind in the entire world, and the entire globe is looking at the success of this sickle cell disease mission. Once the India model is effective and control cost effective, I am sure many other countries, including the African countries, are going to take up this Indian model as an appreciating and implementing in their own countries. Yeah. In the initial phase, 17 states has been recognized as a high prevalent of the sickle cell disease, where it has been included on the Government of India program. The Minister of the Tribal Affairs Ministries and Ministry of Health and Family Welfare Department, jointly they have taken up these issues. They are collaborating with the various state governments of the 17 states starting from Odisha, Bengal, Chhattisgarh, Jharkhand, Madhya Pradesh, Gujarat, so on, so that the sickle cell elimination can be controlled or sickle cell disease can be controlled. There is the initial phase, they have taken up 0 to 40 years. They will examine all the patients' populations. They will give their card, identity card, and they will create the infrastructure and then holistic healthcare facilities across the periphery, across the community level, starting from sub-center to PSC, to additional PSC, district headquarters hospital, and the medical college also. You will be happy to know that Government of India has declared every state to have a one center of competency for sickle cell disease. That means 17 states will have a 17 center of competency which will act as a state nodal center not only for the holistic and training of the sickle cell diseases but also acting as an advisory committee to the concerned government of the state government for the ongoing or for the holistic healthcare services of sickle cell disease. States are free to integrate the other hemoglobinopathies of thalassemia, sickle cell disease as per the state's needs. Government of India has also created a portal where all the patients, all the public will be investigations and the result will be uploaded in the portal. Now today, more than 5 crore populations has been examined, and they have opened up the center of competency, as you told, all facilities starting from prenatal diagnosis, your molecular laboratory, bone marrow transplantations, and every facilities, availability of the drugs and diagnostic facilities, every district headquarters hospital, availability of the drugs in the PSC, even the additional PSC and sub-center level, so that holistically all component, not only they will be diagnosed but also every component will be available, and the sickle cell parents or those father, mother or husband, wife carrying both the genes, they have the facilities of going for a prenatal diagnosis and having an healthy child. To this mission, to this over-ambitious mission, Indian Society of Hematology is the only society of the country to have the hematologists where sickle cell disease, blood disease belong, and they are contributing, they are collaborating, and they are giving as an advisory capacity and a knowledge partner with the Ministry of Health, Ministry of Tribal Affairs, and various state governments to educating and to giving the guidance, not only the doctors, health professionals, health caregivers, patients' bodies, and social workers, and take how to achieve these objectives of this National Sickle Cell Elimination Program. Sickle cell is a social problem, it's not a medical disease, because if you consider the incidence of the sickle cell, it's a ramification, it's a socio-economic impact, it is a social problem, and it can be controlled only with collaboration and active participations of the not only policymakers, the governments, Indian Society of Hematology and Transfusion Medicines, the media people, NGOs and patients groups, and if they cooperate, then only they will be able to control this sickle cell disease. Thank you. Namaskar.